Hello and namaste everyone. As a continuation of our osteological videos, today we are going to talk about the skull. The part of the axial skeleton present in the head of an individual is called skull. The term skull is derived from Viking language word skalli, which means bald head. Vertebrate skull is the most modified part of the axial skeleton and it is present on the cranial end of the axial skeleton. Skull is a protective skeletal complex present in our body to protect the brain, its meningeal coverings, the organ of special senses, and to secure food and oxygen. Skull also gives support to the structure of the face. The bony complex skull is formed of 22 bones if we do not consider 6 ear ossicles, which are firmly connected to each other by means of fibrous joints known as sutures. There are altogether 33 sutures in the skull. Besides sutures, a couple of joints which are not fibrous in nature are the temporomandibular joint and, not seen in this view, the joint between the basi-occiput and basi-sphenoid. If we remove the movable jawbone, lower jawbone mandible from the complex, the remaining skeletal complex is known as cranium. However, it should be noted that the term cranium and skull are used interchangeably and we don't need to sweat too much upon these terms. In fact, the Latin term for skull is cranium, which is derived from Greek term cranion. Now let's talk about the parts of the skull. The functional parts of skull includes the neurocranium and the viscerocranium. Neurocranium includes the bones which form the cranial cavity. Thus, it forms the protective covering of the brain and the meninges. The 8 bones present in the neurocranium are 2 paired bones that are parietal and temporal, and 4 unpaired bones that are frontal, occipital, sphenoid, and ethmoid. 2 subdivisions of neurocranium include the calvaria and the basicranium. The calvaria, also known as the skull cap, vault, or brain box, forms the superior, anterior, posterior, and lateral walls of the cranial cavity. The calvaria is formed by the frontal bone, the occipital bone, and the parietal bones. These bones undergo intramembranous ossification. If we remove the skull cap, the inferior part of the neurocranium can be visualized, which is known as the base of the skull or basicranium. It forms the floor upon which the brain rests. If we take a closer look at the basicranium, we can see the 3 cranial fossae as well. From anterior to posterior side, we have the anterior cranial fossa, slightly deeper middle cranial fossa, and the deepest posterior cranial fossa. This part of neurocranium, that is basicranium, is formed by the ethmoid bone, the sphenoid bone, and the parts of frontal, temporal, and the occipital bones. These bones form by the process of endochondral ossification. We can remember this by highlighting the alphabet E from base and E from endochondral ossification. Viscerocranium, also known as the splanchnoscranium or the skeleton of the face, includes the anterior and inferior aspect of the skull. There are altogether 14 bones in viscerocranium, which form the orbit, the nasal cavity, and the oral cavity. The bones of viscerocranium include 6 paired bones and 2 unpaired bones. The 2 unpaired bones are the vomer, which forms the inferior part of the bony nasal septum, the mandible or the lower jawbone. The 6 paired bones include the nasal bone, the lacrimal bone, the zygomatic bone, the maxilla or the upper jawbone, inferior nasal concha or turbinate, and the palatine bone. Anatomical position of the skull. Skull is said to be in anatomical position when the orbits are facing anteriorly. Infraorbital margin and the superior margin through external acoustic meatus lie on the same horizontal orbitomeatal or Frankfurt plane. We also mention a plane known as Reed's plane, which passes from the inferior margin of the orbit to the center of the external acoustic meatus. Both the Frankfurt line and the Reed's line are used as anatomical reference line in radiology. The general external features of the skull are described by dividing it into various regions. The regions include the norma verticalis or the superior view, the norma occipitalis or the posterior view, norma lateralis or the lateral view, norma frontalis or the anterior view, and norma basalis or the inferior view. Norma verticalis. It includes the major portion of the vault of the skull and appears oval, being wider posteriorly than anteriorly. From anterior to posterior aspect, this view includes three bones that are frontal, parietal, and occipital. The coronal suture is present between frontal and parietal bone, and it is the other term for frontoparietal suture. The sagittal suture is present between the two parietal bones, and it is the other term for interparietal suture. We can visualize the lambdoid suture posteriorly present between the parietal and occipital bones. The term coronal used in coronal suture is derived from Latin term corona, which means crown. Similarly, the term sagittal suture is derived from Latin term sagitta, which means arrow, and the term lambdoid suture is derived from Greek alphabet lambda, which appears like inverted V. The point where the coronal suture and sagittal suture meet is known as bregma, which corresponds to the anterior fontanelle of the fetal skull. Similarly, the point where sagittal and lambdoid suture meet is known as lambda, which corresponds to the posterior fontanelle of the fetal skull. The highest point on the skull is present on the sagittal suture few centimeters posterior to the bregma. The highest point is known as the vertex. Similarly, the maximum convexity that is observed in the parietal bone is known as parietal eminence. Frontal suture is present in the median plane between two frontal bones in early year of life. Persistent frontal suture is known as metopic suture, which is observed in 3 to 12% of the population. This persistent frontal suture, also known as metopic suture, is sometimes misdiagnosed as fracture of frontal bone. In this skull of an old individual, which can be deduced from the fusion of the sutures that are observed here, we can see between the middle 1/3 and posterior 1/3 of the parietal bone the presence of a couple of parietal emissary foramina. These foramina transmit parietal emissary vein and sometimes a branch of occipital artery. These vessels can bleed during surgeries, so we need to be careful about the anatomy of this region. Similarly, a bony point on sagittal suture just medial to these foramina is known as obelion, which is derived from Greek symbol obelus. A couple of bony elevations known as superior and inferior temporal lines may also be seen in this view. To make a better picture, I am showing the norma lateralis aspect of the skull, and we can see that the superior and inferior temporal lines, they start from the zygomatic process of the frontal bone. These lines split and move across the frontal and parietal bones. We can see that the superior temporal line has faded posteriorly, whereas the inferior temporal line continues as the supramastoid crest. These lines form the boundary of a shallow region on the lateral aspect of the skull known as the temporal fossa. The temporal fascia, that is the covering of the muscle of mastication temporalis, is attached to the superior temporal line, while the inferior temporal line indicates the superior limit of origin of temporalis. Norma occipitalis. It includes the posterior aspect of the skull, which appears convex superiorly and laterally but flat inferiorly. The bones included in this view are posterior parts of the parietal bones, upper parts of the occipital bone, and the mastoid part of temporal bones. The lambdoid suture, the parieto-mastoid suture, and occipito-mastoid suture can also be observed clearly. The mastoid foramen is present very near to the occipito-mastoid suture, as can be seen over here. The mastoid emissary vein and meningeal branch of occipital artery pass through mastoid foramen. As these vessels can be source of bleeding during surgery, location of mastoid foramen is important for the surgeons. The bony point where sagittal and lambdoid suture meet, that is the previously mentioned lambda, is also seen. The area of lambdoid suture is sometimes marked by presence of sutural bones, as can be seen in these sites. A cephalometric landmark known as asterion is located at the junction of three sutures, that is the lambdoid, parieto-mastoid, and occipito-mastoid sutures. A median palpable bony prominence known as external occipital protuberance is also seen in this view. It is situated between the lambda and foramen magnum. In this skull, we can see the occipitalization of the C1 vertebra. The external occipital protuberance gives site of attachment for trapezius and ligamentum nuchae. The term nuchae refers to the nape of the neck or the back of the neck. The highest point on this protuberance is known as inion, another cephalometric landmark. From the external occipital protuberance, on either side we can see two bony lines known as superior nuchal line. On the medial two-thirds of this line is the origin of the muscle trapezius, whereas the lateral one-third acts as a site of insertion of sternocleidomastoid and splenius capitis. Sometimes not clearly seen in this bone, there is presence of highest or superior nuchal line as well. The highest nuchal line provides the site of attachment for gallia aponeurotica or epicranial aponeurosis and the occipital belly of occipitofrontalis. We can also observe a prominent vertical ridge running from the external occipital protuberance to the foramen magnum. This ridge is known as external occipital crest. From the middle aspect of the external occipital crest, there is lateral extension of bone, which are known as inferior nuchal line. So this was a description of introductory aspects of the skull and its two views. We will continue with the remaining views in the upcoming videos. Thank you for watching.